Hello everyone, this is Nikki Shindo, Senior Advisor of WHO Health Emergencies Program. I welcome you to eProtect. This is a pre-deployment training for acute respiratory infections, and I'm going to give you acute respiratory infections of public health concern, an introductory session. Here's the learning objectives. By the end of this session, you will be able to describe basic information about acute respiratory infections and how they are transmitted, and summarize the symptoms, treatment, prevention of ARIs or public health concern. Here's the session outline. First, introduction to acute respiratory infections, what they are and how they transmit. Number 2, examples of acute respiratory infections or potential concern. And lastly, number 3, major global ARI events. What are acute respiratory infections? Acute respiratory infection is a disease of the respiratory tract caused by an infectious agent. Respiratory tract is the parts of the body that we use for respiration, meaning that we respirate, inhale and exhale to exchange gases. So symptoms of acute respiratory infections arise within hours to days of exposure to a pathogen, for example, virus, bacteria, or combination of both or another disease-causing agent. ARIs can be mild to severe to fatal, depending on the interactions between the pathogen, the host, and the environment. Some infections can be asymptomatic, meaning that you cannot tell the infection from symptoms. Typical symptoms include fever, runny nose, sneeze, cough, lethargy, body ache, sore throat, shortness of breath, wheezing, difficulty breathing in severe cases. So all sorts of reactions from your respiratory tract. Acute respiratory infections are classified into 2: upper respiratory tract infection, mainly nose and throat, and lower respiratory tract infection, infection of lung and bronchi. Lower respiratory tract infection often require hospitalization and can be very severe and life-threatening. Who is affected by acute respiratory infections? The quick answer is everyone. Acute respiratory infections are very common and widespread disease. Everyone can get ARIs. Lower respiratory tract infection, such as pneumonia and bronchitis, a severe form of ARI, are the leading cause of illness and death worldwide. In lower-income countries, lower respiratory tract infection is the #1 killer of children under 5 years of age. Lower respiratory tract infection can be serious and life-threatening, particularly in the very young, old, and pregnant women, people living with chronic medical conditions. These are the elements that contribute to acute respiratory infection. First is pathogen. We need to know what kind of pathogen is responsible for ARI, and host, who's infected, age, underlying diseases, nutritional status, occupation, immune status, smoking, concurrent or past infections with other pathogens. Third factor is environment. Physical environments such as air quality, crowding, temperature and humidity matters, and also hygiene is an important factor. And contextual environment such as healthcare access and quality, infection control and prevention measures, isolation barrier nursing, medical countermeasures such as vaccine and therapeutics are important factors too. So now I want to talk about interaction of host pathogen environment to create illness. Host susceptibility, disease transmission, and disease severity are all variable for respiratory infections because of the interactions of the host, pathogen and environmental factors. Host factors such as immune system and immune status or the presence of underlying conditions can affect how susceptible an individual is to getting sick with the pathogen and how severe the disease will be. Variations in the pathogen can affect how easily it is transmitted and how severe the disease will be as well. The environmental factors, both physical and social, can also affect the transmission of a pathogen as well as the susceptibility of a host to infection. Therefore, while all people may be at risk of infection, the level of risk is dependent on multiple factors. Risk assessment needs to be done in the context of considering pathogen as well as the other factors that may play a role. So now we switch the topic really to focus on certain acute respiratory infections of concern to public health. As I spoke, acute respiratory infection include common cold and severe pneumonia. But some new diseases or increased pathogenicity of a pathogen can cause very serious effect in people's health and public health. Why are they concerned? Because they are likely to transmit very easily from person to person, and they can cause very severe disease. And people will meet this pathogen for the first time in their life, meaning that they don't have immunity to the pathogen. And this is at the population level, so a large number of people will encounter this disease without immunity. And most of the times, new disease, we don't have any vaccine or treatment existing, meaning only public health interventions. And because at the beginning, this is a new pathogen, we don't know what is causing the disease, so it's unknown or new pathogen. The size of the outbreak is concerning. If the disease spread very quickly, then we will have a large number of sick people overwhelming our health systems. So let's learn examples of acute respiratory infections of public health concern. We have many in the history, but to name few, influenza viruses causing human infection for which the population has little underlying immunity. Severe acute respiratory syndrome, known as SARS-CoV, Middle East respiratory syndrome, called MERS-CoV, or completely new pathogens that are not under our radar screen, and other pathogens. It could be something like pneumonic plague or Legionella. We know the disease well, but it happens in a different context. It could cause a large public health disturbance. So first, to talk about non-seasonal influenza viruses. Well, seasonal influenza viruses we experience every season, annually, and globally. It's everywhere. But in the temperate countries, we have influenza peaks during winter time. So non-seasonal influenza means non-human influenza mostly, and called zoonotic influenza viruses because they came from animal world. What we know about those viruses and commonly face outbreaks are namely avian influenza viruses such as H5N1, H7N9, and swine influenza viruses. H1N1 swine, H1N2 swine, these are same types of viruses in terms of classification, but they are not pure human viruses, but mostly circulating in pig population. And newly emerged influenza viruses from a genetic mutation exchange. Influenza viruses evolve very quickly and known to cause mutations very frequently. So they mix with other subtypes, and also they can change very quickly. So the animal viruses can sometimes infect humans. What are non-seasonal influenza viruses? Human cases are considered rare because certain viruses like certain species. So normally avian influenza stays in the avian population, but sometimes it jumps the wall of the species and infects humans. But this only causes by the direct or indirect contact with infected animals or contaminated environment. There has been any sustained transmission of these viruses among humans, so we managed to contain influenza virus coming from animal population in the past. How does it look like if we humans get infected by animal influenza viruses? Can be asymptomatic, meaning that there's no symptom, and cause a range of symptoms from conjunctivitis, the pink eye, to fever and cough, and shortness of breath, meaning that our lower respiratory tract is infected. It could be very severe, and it could be very mild. And sometimes not only the respiratory tract, but it can also affect gastrointestinal systems. So we have gastrointestinal symptoms like vomiting, diarrhea, and abdominal pain, and so on. Do we have a treatment for a non-seasonal or zoonotic influenza? Yes, most of the influenza viruses are susceptible to the antiviral drugs that we know. We have several, and we can test these viruses in laboratories, whether these viruses are susceptible, meaning if this antiviral drug works for treatment. But the thing is that we have to administer these antivirals as soon as possible, because once the virus replicates, and then it can replicate very rapidly. So if there are overwhelming number of viruses, it will be very difficult to fight only with antivirals. So the best is to administer when infection is suspected without waiting for diagnosis. This is very important. The other treatments are supportive based on patient clinical condition, but this makes a huge difference, especially for the very severely sick people. Well, the best is, of course, to prevent infection by these non-human influenza viruses. How do we do that? We think One Health approach to work with animal sectors and people working for food chain. It's very important. So not only protecting humans, but we have to control the disease in animals and also in the environment. And also, when you see a sick animal, be careful. Avoid direct and indirect contact. And also mindful of environmental contamination, because virus may exist in the environment. Avoid the consumption of raw or undercooked animal products. Always cook food thoroughly, because viruses are very sensitive to heat. If you cook well, they die. And additional special precautions are to be taken in healthcare settings. Sometimes, because of the severe patient excreting more viruses, healthcare facility can be a very vulnerable place for amplifying the disease. So here we recommend to implement strict infection prevention precaution taken by healthcare workers. And practice good hygiene, especially regular hand washing before and after touching animals at farm, markets, or other places where animals may be present. So if you are interested in more information about non-seasonal influenza, these are the useful links, so please have a look so that you can learn more about zoonotic influenza viruses. The second acute respiratory infection of public health concern is Middle Eastern Respiratory Syndrome. It's called MERS in short. MERS is an acute respiratory infection caused by a coronavirus family called the MERS-CoV. And this disease was first reported in a severe pneumonia patient in Kingdom of Saudi Arabia in 2012. As of January 2020, it has caused over 2,500 human infections and over 800 deaths. Most human cases have been reported in the countries of the Arabian Peninsula. Cases and outbreaks have been reported by countries outside the Middle East, but these are usually related to infection initially acquired in the Middle East. Human-to-human transmission in healthcare setting accounts for the majority of MERS cases worldwide. MERS-CoV has not yet caused widespread outbreaks outside of healthcare settings. There was a large outbreak associated with hospitals in the Republic of Korea in May to June 2015, following a human case, just one case, introduced in Korea who had traveled to the Middle East. MERS-CoV is widely circulating among dromedary camels, thought to be transmitted to humans via direct or indirect with camels and camel-related products, for example, raw camel milk. How does the disease transmit? Infected persons can transmit the virus to other persons in close contact. This has most often occurred in healthcare settings among patients and between patients and their caregivers. Incubation period, which means that when the people get the virus and people present illness, is 5 days on average, but it ranges from 2 to 14 days. And who are susceptible to this virus? Well, healthcare workers, because they are caring for the sick patient infected with this virus. And people caring for the cases who come very close to the patient while they're very sick, they are at the risk of infection because of their close contact. Severe illness seems to occur more frequently on older people, people with a compromised immune system, and people with underlying medical conditions: heart disease, kidney disease, chronic lung disease, and diabetes and cancer. Human infections can be asymptomatic, meaning that you cannot tell the person is sick, or can cause a range of symptoms from mild to severe, such as fever and cough, to shortness of breath. Pneumonia, an infection of the lung, may occur and may require hospitalization and intensive medical treatment. Severe illness has resulted in death in about 1/3 of the cases. In some cases, infected patients have also reported gastrointestinal illness. Majority present diarrhea. There is currently no specific treatment for MERS-CoV infection in humans. Treatment is supported based on the patient's clinical condition, such as mechanical ventilation in the case of respiratory system failure. So how to avoid this MERS-CoV infection? Avoid unprotected contact with dromedary camels. Persons with underlying medical conditions, as described previously, should avoid contact with camels. Avoid the consumption of raw or undercooked animal products, including milk, meat, and urine. Practice good hygiene, especially regular hand washing, before and after touching animals at farms, markets, or other places where camels may be present. Special precautions are to be taken in healthcare settings to prevent the spread of the virus among patients and between patients and healthcare providers. For more information about MERS, you can follow these links to have a look at our MERS dedicated website with more information. So now we are going to review some of the major global ARI events. Here are some examples historically known as major global ARI events. Influenza pandemic. We believe that influenza pandemics recurs to the world every 10 to 14 years interval. In 1997, avian influenza A H5N1 in humans occur in Hong Kong Special Administrative Region. This was the introduction of first known avian influenza A, which caused very severe diseases and death. In 2002, SARS coronavirus emerged in China, caused more than 8,000 patients. In 2003, avian influenza A H5N1 recurred and spread in Eurasia and Africa, caused human infections in 15 countries. In 2012, MERS-CoV was detected in Saudi Arabia. 2013, avian influenza A H7N9 emerged in humans in China. In 2019, we are facing 2019 novel coronavirus emerged and causing outbreak in China. So if you are interested in more updated and detailed information, we invite you to visit WHO website, where you can find a lot of information related to acute respiratory infection of public health concern. Thank you.